Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back, everyone. It is now 2021, and we're still very much so in the middle of the pandemic, even though we have a new vaccine that has arisen. Actually, not just one, but now currently on deck there are 3 vaccines that are available, or at least being rolled out and shipped out to countries, various countries around the world, either directly from the pharmaceutical manufacturers such as Pfizer, or they will be delivered to smaller countries through the WHO using their COVAX and ACT Accelerator tools. And with that, there's still, here in British Columbia where we're going to start, there's still a number of active outbreaks and in long-term care facilities, and some of them becoming fatal. There are also some hotspots or occurrences happening in schools, such as one was Earl Marriott School in Surrey, BC, where they had a number of students test positive after attending a physical education class. So Dr. Bonnie Henry was asked questions about that and if the class should have been shut down, and more or less her response was that we need to find a better way to handle these classes. But meanwhile, she is not going to ask the schools to shut down gym classes. So then we will move on to the WHO, who is going to have guests from the SAGE, which is a strategic group who are advising world leaders on how to actually administer the vaccines as they come on, so that we get the best results out of the immunizations and the vaccines that are being distributed. Part of that, of course, is I believe they're going to want to start with the most vulnerable people, so that, and the caregivers, so that those two groups don't infect each other. So, and as you probably heard, in Alberta, while Jason Kenney, the premier of Alberta, totes that Alberta was the first to do a lot of things to enable travel, they are now coming under fire where ministers have traveled abroad, and Jason Kenney is taking responsibility for such things. At the same time, he's had a number of his cabinet and staff who are MLAs resigning their post. So we'll have to keep a close eye on what's going on with that. So first, let's listen to what Dr. Bonnie Henry has to say here in BC.
Thank you, and good afternoon. So today we are reporting on 4 periods from the end of 2020 to today. So on December 31st to January 1st, we had 565 new cases diagnosed in British Columbia. From January 1st to 2nd, an additional 607 new cases. From January 2nd to 3rd, another 500 new cases. And in the last 24 hours, 539 new people were identified with COVID-19. So that brings our total from last Thursday to 2,211 new cases diagnosed with COVID-19, including 22 who were epidemiologically linked. That brings our total to 54,201 people in British Columbia. Of the new cases, 389 were people who live in Vancouver Coastal Health, 1,301 were people living in the Fraser Health region, 64 people were in Vancouver Island Health, 288 people in Interior Health, 169 in Northern Health. We now have 6,823 active cases across British Columbia, of whom 351 people are in hospital, 76 of whom are in critical care or ICU. Additionally, we have 8,785 people under active public health monitoring, excluding Northern Health, which continues to work on our IT system around that issue. So an additional 45,229 people have recovered from COVID-19. Over the past 5 days, we've had an additional 4 days, we've had an additional 45 people who've died from COVID-19 in British Columbia. And once again, the majority of them are our seniors and elders in long-term care, or in some cases in our community. And I know of at least 2 First Nations elders who passed away over the last few days. And that, of course, affects us all. We've had 946 people who've died from COVID-19 in British Columbia in this pandemic. And I know their families, the care providers, and our communities are all mourning their loss. And our condolences go out to everybody who's been affected. We have 6 new healthcare outbreaks in the province at the Braddon Private Hospital, Creekside Landing, Kin Village, Madison Care Centre, Royal City Manor, and Williams Lake Seniors Village. An additional 8 outbreaks have been declared over, including Chilliwack Lifestyles, Finnish Manor, which was another one of the more difficult outbreaks that we have had in the province, Holyrood Manor, Northcrest Care Centre, St. Jude's Anglican Home, the Gardens at Qualicum Beach, the Residence at Clayton Heights, and 3 Links Care Centre, another one of those most challenging of our outbreaks, have thankfully been declared over now. That leaves us 52 active outbreaks in long-term care and assisted living and 8 in acute care, involving 1,427 residents and 758 staff. In addition, there's been 1 new community outbreak declared at the Portal Shelter in the Fraser Health region, and the one that we had been managing at Cove Shelter has now been contained and declared over. Today, I'm going to give an update on our immunization program and the vaccination status and what how we're managing that in British Columbia. I know I had given some of this information prior to the Christmas break, but we have more details now, and we have additional information, particularly from the National Operations Centre, and some guarantee of when some of our vaccine will be arriving. So a recap of some of the important information about our BC immunization plan. For the first quarter, so what we're talking about are the doses that we received early in December, but for January, February, and March, all of our Pfizer and Moderna vaccine will be prioritized for administrations to priority populations, and particularly as their first dose for the doses we received in December and into January. We've made that decision based on trying to protect as many people as possible during this highest risk period, and making sure that we are still able to give second doses within a reasonable amount of time. And to do that, we have delayed the second dose to approximately 35 days for most people in this first phase. as we know that now additional vaccines will be coming later on in February and March. And the scheduling of these priority groups will vary a little bit as we deal with additional outbreaks in our communities, in long-term care in particular, and in many communities. So we initially put out some more details of what the thinking was, aligned with the National Advisory Committee on Immunization for Q2. So that's April, May, June of this year. We are now working through what those details will look like, and we will be presenting near the end of January more details similar to what we're presenting today for additional populations. Our focus right now with the vaccines that we know we have coming in the coming few weeks is on these priority populations, and I'll run through these again in some detail. So from December to February, we aim to immunize approximately 150,000 individuals. And I will make a note that we have received a certain amount of vaccine, or we're guaranteed to receive a certain amount of vaccine for Q1 of 2021. Some of that vaccine, thankfully, came to us early. It doesn't mean that the doses that we received in December are added on to those we're expecting to receive in January, February, and March. It's the same amount that we're expecting to receive in the 3 months. Some of it just came early in December. So our focus for the next month to the end of January, so from the doses we received already to February, is residents and staff of long-term care. And we have said that from the very beginning. Those are the people that we know need our protection most. And that's approximately 70,000 individuals across the province. We also know that people who are living in assisted living are also at higher risk because of the communal living setting for this to be spread very, very quickly. And that's approximately 13,000 individuals. We also want to make sure that those people who are in hospitals right now awaiting placement in a long-term care home are protected so that they can get into those care homes as soon as they're available. And that includes about 2,000 people in awaiting long-term care placement, either in the community or in hospitals. As well, we know that it has been the most challenging for families and those with loved ones in long-term care and assisted living, and we will be ensuring as well that essential visitors are able to access immunization. Our second important goal, of course, is to make sure that our healthcare system is protected and is able to operate and efficiently. And we have seen a number of outbreaks in our acute care facilities, and not only does it affect operations because of people being sick and it being transmitted, but also staff need to be off because they have been exposed. So it is important for us to make sure that we are protecting particularly those people who are on the front line of the COVID response and keeping our health system available for everybody else. And that includes ICU, emergency departments, paramedics who do transports back and forth and work in long-term care and in our hospitals, and key people for the response. And that's approximately 30,000 healthcare workers around the province. In addition, we have an important commitment to remote and isolated First Nations communities that we've seen the devastation that can happen if this virus gets into those communities. As well, we know the access to care is much more challenging, particularly as we're heading into winter months. Once we get into February, with the vaccine that we are expecting to have in January, we are hoping and we're planning to get through that group of people. Once we get into February, we don't yet have guaranteed doses of vaccines, the actual numbers that are going to arrive in February, but we expect that will be coming up this week, and that we'll have a better idea of exactly how many doses we will have each week through February and March. And it is this system that we're getting into across the country of testing the system, making sure the planning and the logistics is getting into place. And that is coming together. It has been challenging, and as we mentioned when we started this, we are learning. There has been bumps and delays, and we'll talk a little bit about some of those in a minute. But after we finish this first high risk and high priority groups, we'll be moving into priority populations that are also the same ones we were talking about for the following 2 months of quarter one. And that's about 400,000 people will get their dose 1, given the way that we have set up our schedule. That includes community-based seniors over the age of 80. And for Indigenous people, we've lowered that age group, recognizing the higher risk of having some more severe illness in that age group. People experiencing homelessness and using shelters, and as we've mentioned as well, we've had a number of outbreaks, particularly the downtown east side. We've had a couple of shelter outbreaks in Fraser Health, and again, people who are in using shelters, who are in those situations, are much more likely to end up in hospital. As well, we have a responsibility for other communal living where we know people are at risk, and that includes our correctional facilities, group homes, and mental health residential care. We are also looking at how we can identify people who have home care and home support, and making sure both recipients and staff who work in those sectors are immunized as a priority, and additional both hospital staff and community healthcare workers, including GPs and specialists and others. As well, we are continuing our work with First Nations communities to identify the at-risk communities across BC. So that is our plan for what we know right now for the first quarter of 2021. Once we get through that, we know, at least from the contracts that we know are the health that Canada has in place with both Pfizer and with Moderna, as well as additional seven in total additional contracts with the other vaccine manufacturers. What we have been told is that the contracts for Pfizer and Moderna will scale up come March. So we are expecting to have way more of those vaccines once we get into April, May. We also expect approval in Canada of additional vaccines, and we've heard that the AstraZeneca vaccine has been approved for use in the UK. We know that Health Canada has received at least some of the data and has started the expedited review process, both for AstraZeneca and Janssen. We don't know the exact timelines, but we're hopeful that those will be approved for use in Canada sometime in the first quarter of this year. As well, however, the thing that we also know is the contracts, particularly for these vaccines, don't come into play until quarter 2 in Canada. So we may not receive the Janssen or the AstraZeneca vaccine until April, depending on the contracts and depending on production worldwide. So there's a lot of unknowns still about those vaccines, although we are, of course, hopeful that the AstraZeneca vaccine, as we know, is very effective, and it can be transported at fridge temperatures, which makes it much easier for us to use. So contingent on supply, our plan is to begin our mass vaccination strategy based on age, and then descending in 5-year cohorts after our 80-plus priority population is completed. And we are working on how do we do that to make sure that it's accessible and fair for people around the province. And we will be detailing that later on this month. So to go back, the estimated number of doses from December to March that we are expecting, both of Moderna and Pfizer, is about 792,000 doses. And our plan is to provide at least 549,000, 550,000 people their first dose, and some of those people will also receive their second dose. So that's approximately 542,000 doses of Pfizer and 250,000 doses of the Moderna vaccine. So we, as I mentioned, we're still working. Now we're about 3 weeks ahead of time. We were in a just-in-time loop, but it's settling out across the country, and we have a better idea a little bit further down the line of how much vaccine we're going to receive each week. So as of January 4th, as of today, we have received 54,625 doses of vaccine in the province. Of that, 34,125 doses were of the Pfizer vaccine. Our very first week, we received it 3,900 doses, so a very small amount, as you recall, in both one place in Fraser, one place in Vancouver Coastal, as a way to test and proof the system. The week of December 21st, we received an additional 22,425 doses of the Pfizer vaccine, and it was distributed to all health authorities and was around the province. It came at various days through the week of December 21st, so it didn't all arrive on Monday. It arrived between the Tuesday and Thursday around the province, and last week, December 28th, we received additional 7,800 doses, all in Fraser Health. The Moderna vaccine, which we're very excited, received approval and notice of compliance on in late December, December 23rd. We received one shipment of 20,500 doses, and it arrived, most of it arrived actually on December 31st. It was to arrive the week of December 28th, and we did receive some on the 28th and through to the 31st. And again, it was received in all health authorities, and the First Nations Health Authority as well received some as per our agreement, working together to provide vaccine to high-risk, remote and isolated communities. So we expect to receive an additional 16,575 doses of the Pfizer vaccine this week, January 4th, the week of January 4th. We've not yet received it. We have just received the packing labels, so we expect it to arrive within the following 2 to 3 days, depending on where it's going in the province. I will note that the next shipment of our Moderna vaccine is not expected until the third week of January, although it is varying a little bit. So the Moderna vaccine in Q1 will be coming at 2 to 3 week intervals, where the Pfizer vaccine, we're now in a place of receiving it weekly. So as we've talked about a little bit over the last few days, there's been a lot of planning and preparation that's required for these vaccines. They are not our usual fridge-stable vaccines that we're used to handling. They are very delicate, and both the Pfizer and the Moderna in particular are very delicate in how they're made, and they need to be handled very cautiously, most of it while frozen. So we have done a lot of work preparing for the logistics, whether it's security, handover, temperature controls. The temperature controls are read for every single box in every package centrally through Pfizer, and we need to have approval before it can be taken out of the shippers, etc. There's a lot of things that we're not used to having to do when we're handling vaccines, including ultra-low temperature gloves, being able to work with liquid nitrogen, the thermal containers, which are quite heavy, and how do you get them from one place to another. As well, we've been planning and preparing for the redistribution logistics. So taking the vaccine that's frozen in the, we call them the pizza boxes, and being able to move them to other places. Again, the permission to do that from the company was only received the week before Christmas on the 21st or 22nd, and the shippers, that they have the special containers that you need to keep them in to move them to other places were coming online as well. As well, we need to plan and coordinate the immunization clinics, making sure that immunizers understand the products, how they're reconstituted, how much is in a dose, what the side effects are, the details that we need to do as clinicians to make sure we can safely provide vaccine to people and know how to deal with the adverse effects should some of them happen. And we know, of course, about things like having allergic reactions to vaccines, which can happen at clinics and which we need to be prepared for. Additionally, we needed to ensure we have a system in place that records everybody's immunization, so we know exactly what lot of which vaccine they received. One, so that we can monitor for safety, which we do very carefully, and also so that we make sure people get the right vaccine for their second dose. So I'm not going to go through all of this, but it's here for you about the Pfizer distribution and logistics, which we say are quite fussy. They have limits on how it can be moved and what size, how many doses you can move and redistribute at any point in time. and then how long they can be kept once they're out of the freezer and thawed. So up until today, the Pfizer vaccine has been allocated in British Columbia in the following. So Fraser Health has the majority as the largest population, 16,575 doses, 1,950 to Interior, Island, and Northern Health, and 11,070 doses have gone to Vancouver Coastal Health. So up into the end of today, including the estimates for today, we are expecting that 25,744 of the 34,000 doses will have been delivered to the priority populations across the province. For the Moderna vaccine, as I mentioned, it has fewer limitations on mobility in that it can be transported at -20. We have a few more of those freezers around in the province, and it can be broken down into as small as 100 units. So we received, as I mentioned, one delivery of the vaccine of 20,500 doses. It's gone in small amounts to each health authority and with specific targeted amounts to the First Nations Health Authority around some of the remote and isolated communities. So this has allowed us to redistribute this vaccine not only to those remote communities where the need is great, but also to long-term care and assisted living sites directly, and makes it much easier for us to provide vaccination, particularly in some of our smaller communities, to residents of long-term care. And there's a mixture in places like Vancouver and Fraser Health, where they have the capacity to transport the Pfizer vaccine in the urban area in the higher amounts. So a lot of it has been figuring out how much needs to go where in the last little while. And to date, there's been distribution to many rural and remote First Nations communities, prioritized based on risk and need and the numbers of seniors and elders in the communities. And our First Nations Health Authority has been working with all of us very closely on this, and the nursing station and community clinics will be delivering these doses through this week. So that is very exciting news. We saw some wonderful pictures of elders receiving their vaccines in some places of the province just this past weekend. So that's good news. Up until including today, about 1,600 doses of Moderna will have been administered in BC. As I mentioned, really the majority of it arrived on December 31st, so it has been a slower rollout than we were hoping, but we will be using up the additional doses over the coming week. So up until close of clinics yesterday, we had vaccinated 24,139 people, and 22 of that, 690 was from the Pfizer, and about 1,449 people received the Moderna vaccine. So if we look at where did this vaccine go, about 20% of it made it to residents of long-term care, and that's in the limited time that we've been able to get it out actually to residents. Just under half has gone to staff of long-term care, and that's where we started, recognizing that staff could come to the vaccine centers where we had the Pfizer vaccine. We have a small percentage for staff and residents of assisted living, and another third approximately for healthcare workers in the various settings that we've talked about. So for our next 2 weeks, in particular, to January 18th, we are planning on we will deliver the remaining doses from December and January, and the about 16,575 additional doses we have arriving this week. And the focus, as I've mentioned, will continue to be on long-term care and assisted living, making sure that we are protecting those who are most vulnerable in our communities, and then coverage of our front lines of acute care and ongoing immunization in our at-risk First Nations communities. So that is where we are with immunization. It's a monumental task, and there are many months left to go in this. We are constrained by logistics and also by how much vaccine we're receiving, but we're optimistic, and we are focused intensely on making sure we protect people in long-term care and assisted living as quickly as we possibly can, and of course protect those most at risk in our communities. So today, again, many people are getting back to work and back to school after our winter break, which means reminding ourselves about how important it is that we continue to use our layers of protection wherever we may be. And I want to remind people that our orders are still in place, and we will be looking at what we need to do to get us through this next few months as we're ramping up our immunization program and able to protect more people in our community. But first, I want to thank and commend many, many people, the most of us in British Columbia, who put their usual holiday traditions and celebrations aside and followed public health orders to help protect our families, our communities, and each other from COVID-19. Since the start of this pandemic, many sacrifices have been made, both small ones on a day-to-day basis and many big ones, including and up to the very last day of last year. Despite these efforts, we know some people chose to bend the rules, and we continue to have transmission in our communities. And because we know there's a delay between when those exposures happen and when people become sick, we know that we can start to see increased numbers of cases. We've talked as well about people not being tested as frequently during this past period, this holiday period. As a result, right now I'm asking everybody to be extra vigilant. If you are feeling unwell at all, if you went out for that party or that group meeting or that gathering with family members and you're not sure, please stay home. Stay away from others. And if you have concerns, call 811, take the symptom checker, or get tested. Our testing facilities are open and available and ready for anybody who has concerns, who may have been exposed, who has any symptoms. I also ask you, though, to pay close attention to those symptoms of COVID-19. We know that this UK variant has been found in one person here in British Columbia, and we are looking to make sure that it's not in many more. But it reminds us of how easily this virus can spread. If you develop a cough, loss of sense of smell or taste, fever or chills, difficulty breathing, if you've been at those parties or heard of others who you are close to who are ill, get tested, stay away from others. It is more critical than ever right now that we are all cautious. Our hope is that that leveling off that we saw before the holidays will continue, that enough of us did follow the rules and make sure that we're not transmitting this virus, that we will start to see the numbers coming down again as our immunizations are ramping up. The actions each of us takes today will make a difference for all of us tomorrow and the next week. I want you to know that by choosing to use your layers of protection and following restrictions and orders in place, you are saving lives. We're in this race right now. We need to make sure that we can win. We are 4 days into the new year, and I'm sure many people have set New Year's resolutions. What we know about resolutions is that by doing a little bit every day, it turns something new into a habit. And once you have that habit, it can become your success. We already know and have our COVID-19 protection habits. We've been doing it for a while now. So doing your part to protect those around you and yourself isn't new. But we all must keep going now. We know what can happen if we let down our guard. I encourage you, everyone, keep it up, keep it going. Let's make this year our year of success, overcoming COVID-19. We will get through this storm by working together and by remembering to be kind, to be calm, and to stay safe.
Oh, hi, Dr. Henry. There were 37 cases in 5 classes at a Surrey High School before the Christmas break, and the superintendent said they were linked to PE class, specifically the school gym and the weight room. Is it a good idea to have students, many of them unmasked, exerting themselves and exercising in an indoor space like a school gym? Doesn't this huge number of cases at Earl Marriott suggest we shouldn't be having PE classes right now, especially without a mask requirement?
Yeah, so I think what you bring up are a number of different things. One is what procedures were being followed in that class in that school, whether all PE classes need to be modified, how they can be done safely. We know that it's really important, and that for some children, the physical aspect of school is important in terms of their learning. So there are ways it can be done safely. The fact that it's happened in one place means that we need to relook at how it is done and can be done safely. And you talk about masks. Masks are an important part of the safety procedures in schools, in all schools. However, we know that when you're exercising in physical exercise, when they get moist, they're not as effective. So I don't think that's the answer to PE classes, but I do think there are things that need to be put in place to make sure that if PE classes are being offered, they're offered safely.
Okay, so we know that there are a number of cases growing and infections growing in British Columbia. But let's just focus on the fact that since the start of the immunization, when we first got this report, that they have done over 24,000 people have been immunized or vaccinated from COVID-19. We'll stay focused on that as we move forward towards the WHO, where they actually have the SAGE group talk. They had their talks, and they were giving a summary of the discussions that were given in private. They had their own meeting, and they released a series of statements and answer questions to the press afterwards. So some of the statements here, we're in a race to prevent infections and bring cases down, to protect health systems and save lives while rolling out a highly effective, safe vaccines to high-risk populations. This is not easy, but if we act together, we can both win the race and get ahead of the virus. And this was following an emergency listings last week. The SAGE group met today with policy recommendations to use the Pfizer biotech vaccines. Okay, and in members of the international scientific team of COVID virus origins began traveling from their home countries to China to learn that the Chinese officials have not finalized the necessary permissions for the team to arrive in China. So they're still waiting to talk to the officials in China about what is happening there with COVID-19, where the virus was first discovered.
Good morning, good afternoon, and good evening. Wherever you are, I wish you a happy New Year. In our first briefing of 2021, I want to take a quick step back and tell you what's going to be coming up in the next few weeks. The pandemic is still a major public health crisis. We're in a race to save lives, livelihoods, and end panic, and I will share more on that shortly. However, WHO is not just fighting the pandemic. We're fighting numerous disease outbreaks across the world. And our work goes far beyond emergencies. We work to improve human health in all its aspects, from birth to old age. As shown in the past year, WHO is working day and night to accelerate science, provide solutions to challenges on the ground, and build global solidarity. This is as important for tackling the pandemic as it is for getting essential services back up and running again. From preventing mothers and their children dying in childbirth, to tackling silent emergencies like antimicrobial resistance and mental health, to the prevention, screening, and control of HIV, TB, malaria, and neglected tropical diseases. This month, for example, is Cervical Cancer Awareness Month, where WHO is working with partners around the world to accelerate the first global health strategy for the elimination of a cancer. We have learned a lot in the last year, not least that health is an investment in overall development, critical for thriving economies and a key pillar of national security. Health cannot be an afterthought when we have an emergency. We must ensure truly integrated primary healthcare systems that effectively prevent, screen, and treat infectious diseases and like diabetes, cancer, and heart and lung disease. The latter collectively lead to the deaths of more than 40 million people every year. The Covid-19 pandemic has shown us once again how a new infectious virus puts those with underlying conditions at highest risk of dying. And those countries that have high numbers of people with health conditions put extra stress on the health system. And we must work with those focused on the climate crisis, which directly impacts health. Ultimately, we need to invest in preparedness and surveillance to stop the next pandemic and ensure that everyone has access to quality health services. In the year ahead, scientists and public health experts from inside and outside WHO will continue to work with us to break down the latest science and innovations and putting forward solutions so that we can build back greener and stronger health systems. My one hope is that there is less politicking about health in the year ahead. We have entered a new phase of the pandemic where solidarity is needed like never before. We are in a race to save lives right now, and as my colleague, Dr. Mike Ryan, said back in March last year, it's important in any crisis to act fast and have no regrets. Case loads are so high in several countries that hospitals and intensive care units are filling up to dangerous levels. For some countries, during the recent holiday period and cold weather, people mixed indoors more, which we know is riskier and will have consequences. New variants, which appear to be more transmissible, are exacerbating the situation. We call on all countries to increase testing and sequencing of the virus so that we can monitor and respond effectively to any changes. Ultimately, countries have to consider their epidemiological situation and take appropriate measures based on the data. It's a tough balancing act, but ultimately saving lives, protecting health workers, and health systems must come first. I know it's tiring, but it's many times worse for those working or being treated in an overcrowded hospital, or for people who have had their cancer treatment postponed. So we must act for the most vulnerable that need help right now, as well as minimizing contacts in this critical period. Governments must support people who have to isolate or quarantine. Just as governments have generated stimulus to keep economies going, It's important to find innovative ways to offer people the chance to isolate safely away from others. To break chains of transmission, we must identify and find those who are infected, provide the care they need, and help them truly isolate safely. We are in a race to prevent infections, bring cases down, protect health systems, and save lives, while rolling out highly effective and safe vaccines to high-risk populations. This is not easy. These are the hard miles we must tread together. But if we act together, we can win both races and get ahead of the virus, while also limiting the opportunity for the virus to mutate further and threaten the health tools we currently have. Last week, WHO issued its first emergency use listing for a COVID-19 vaccine, the Pfizer-BioNTech vaccine. And yesterday, it was also encouraging to see the AstraZeneca vaccine rollout begin in the first country. 1 year on from WHO issuing its first disease outbreak news report about this virus, more than 30 countries have started vaccinating their high-risk populations with various COVID-19 vaccines. The scientific community has set a new standard for vaccine development. Now, the international community must set a new standard for access. COVAX has been backed by 190 countries and economies, and I want to see all manufacturers channel supply to COVAX quickly so that rollouts can begin and those at high risk are protected around the world. We owe it morally to health workers everywhere who have been fighting this pandemic around the clock for the best part of a year, to vaccinate them all as soon as possible. People must come first over short-term profits. It's in countries' self-interest to shun vaccine nationalism. Vaccinating health workers and those at high risk of serious disease is the fastest way to stabilize health systems, ensure all essential health services are up and running, and that a truly global economic recovery can take place. I urge all governments to work together and live up to their commitments to equitable distribution globally, and all pharmaceutical groups to boost supply as quickly as possible and to fully participate in COVAX. The 100-100 initiative, driven by WHO, UNICEF, and the World Bank, is supporting over 100 countries to conduct rapid readiness assessment and develop country-specific plans for vaccines and other COVID-19 tools. So far, more than 90 countries have already completed the assessments, and our teams are working around the clock to ensure that governments and health systems are ready for global vaccine rollout, but we need consistent, predictable, affordable supply of safe and effective vaccines. Morally, economically, socially, and for global security, we must act together right now to ensure equitable rollout. Following the emergency use listing last week, the SAGE group met today to discuss policy recommendations for the use of the Pfizer vaccine. I would like to invite the chair of SAGE, Dr. Alejandro Cravioto, to tell us about the recommendations. The floor is yours, Alejandro.
The Strategic Advisory Group of Experts on Immunization was established by the Director General in 1999, and it's comprised of 15 experts from around the world charged with providing independent advice to the WHO DG on all policy-related issues of vaccines and immunization. The group is very well balanced geographically and gender-wise. In June of last year, as we do with other vaccines, SAGE set up a working group for the COVID-19 vaccines that were being developed. The group consists of 26 experts from around the world in all different areas and have consistently been working for the past months, at least 2-3 times a week, to be able to help us develop a number of documents and issues that we have been reviewing at SAGE level. The first product of the working group was a values framework for allocation and prioritization, which was presented to the DG and approved in September of 2020, and then a roadmap of prioritization for the groups that should be set up for vaccination, which was also approved and disseminated in October of 2020. These documents have been translated to all the UN official languages, or the WHO official languages. And today we met to look into the approval of the WHO emergency use listing of the Pfizer-BioNTech mRNA COVID-19 vaccine. The meeting was initiated with a review of the current situation of the COVID vaccine development pipeline, and of course the issues related to these SARS-CoV-2 virus variants, which is something that is worrying everyone. We looked at the global, regional, and country level plans for COVID vaccine safety monitoring. And we looked at the safety and efficacy data from phase 1 to 3 clinical trials of the Pfizer-BioNTech mRNA COVID-19 vaccines, BNT162b2. This was presented by the Pfizer and the BioNTech experts, and was discussed by the SAGE members and the members also participating in the session. We deliberated and came out with the following recommendations. SAGE recommends the administration of 2 doses of this vaccine within 21 to 28 days. While we acknowledge the absence of data on safety and efficacy after 1 dose beyond the 3-4 weeks studied in the clinical trials, SAGE made a provision for countries in exceptional circumstances of vaccine supply constraints and epidemiologic settings to delay the administration of the second dose for a few weeks in order to maximize the number of individuals benefiting from a first dose. In the case of the anaphylactic reactions after administration of the Pfizer vaccine that have been reported outside of the clinical trials, SAGE recommended that the vaccine should be administered only in settings where anaphylaxis can be treated. So we provided a specific narrow exclusion for vaccination and on the observation period, as well as the management, monitoring, and reporting of any safety events. We recognize the importance of vaccination of pregnant women, especially given the priority for protection of health workers, of whom a large proportion globally are, of course, women. Nevertheless, in light of the data limitations, SAGE was not able to provide a recommendation for the use of the vaccine in pregnancy until more safety data are available. However, we made a provision for situations where a benefit of vaccination of a pregnant woman outweighs the potential risks, such as health workers at high risk of exposure. We have done this before for other vaccines, as the use of the Ebola vaccine in the Democratic Republic of Congo before. SAGE acknowledged the lack of data for recommending the vaccine to lactating women, and given the importance of breastfeeding, we encourage the companies to be able, or the company to be able to bring information necessary for us to make a decision in the near future. As with the case of the pregnant women, we have also made a provision in which if a woman is part of a high-risk group, then we recommend the vaccination without the stopping of the breastfeeding. In the case of persons, SAGE recommends that COVID vaccination be offered regardless of a person's history of asymptomatic or symptomatic SARS-CoV-2 infection. Available data currently indicate that symptomatic reinfection within 6 months after an initial infection is rare. Thus, in the context of limited vaccine supply, persons with a PCR documented SARS-CoV-2 infection in the preceding 6 months may choose to delay vaccination until near end of this time period. This would encourage the use of the vaccines for other people who have not been exposed to the virus and thus have a much larger portion of the population protected. As noted in the prioritization roadmap, SAGE re-emphasized that national programs should take specific steps to identify groups that are proportionally affected by COVID-19 and those who face health inequities due to social, structural inequities in order to address barriers to vaccination and achieve equitable access to the products. In the current period of very limited supply, preferential vaccination of international travels would counter the principle of equity. Because of this and the lack of evidence to inform whether vaccination reduces the risk of transmission, SAGE currently does not recommend COVID-19 vaccination of travelers unless they are also part of a high-risk group identified within the prioritization roadmap. SAGE recommends the continued post-authorization monitoring of COVID-19 vaccines for effectiveness and safety, and listed multiple specific areas of additional research on COVID-19 vaccines, such as vaccine efficacy against SARS-CoV transmission, duration of protection, vaccine efficacy against the virus variants, vaccine efficacy and safety in children younger than 16 years old, immunogenicity and safety, and especially co-transmission with other vaccines and vaccine interchangeability. This is important, especially with the co-administration for the elderly group with an influenza vaccine, if that were possible. In the coming weeks and months, we will continue to review the other vaccines as they become available, and with the data coming from the manufacturers when made available for these deliberations and as part of the regulatory processes are undertaken. The recommendations have been sent to the DG for approval, and once this has been achieved, then we will publish them in the weekly epidemiological record in a few weeks so that everybody is aware of this first approval of this COVID-19 vaccine. I would leave it there, sir, and see if there are any questions that somebody would like to ask. Thank you very much.
Every country needs to row in unison in the same direction to beat this pandemic. Solidarity, multilateralism, and collaboration are key so that we win the race against this pandemic quickly and escape these stormy waters together. Lastly, over the past 24 hours, members of the international scientific team on COVID-19 virus origins began traveling from their home countries to China. This was as per arrangements jointly developed between WHO, the Chinese government, and the countries for which the team was meant to travel through on their way to Wuhan. Today, we learned that Chinese officials have not yet finalized the necessary permissions for the team's arrival in China. I'm very disappointed with this news, given that 2 members had already begun their journeys and others were not able to travel at the last minute. But I have been in contact with senior Chinese officials, and I have once again made it clear that the mission is a priority for WHO and the international team. I have been assured that China is speeding up the internal procedure for the earliest possible deployment. We are eager to get the mission underway as soon as possible. I thank you, and once again, Happy New Year. Fadila, back to you.
Okay, so we do need to talk about Alberta and what is going on there with the provincial government or Alberta. They've had a number of ministers resigned, including Tracy Allard and Jeremy Nixon, who have resigned from the head of municipal affairs and the parliamentary secretary. Jason Steffen, who resigned from the Treasury Board. Tanya Ferr, Pat Riem, and Tanny Yo lost their roles in the legislative committees. So that's sounding like quite a blow to Alberta with their government and how they actually get things done there. So as when they first came to light that these ministers had traveled abroad, they traveled outside of Canada to the U.S. and the United Kingdom among some of the destinations that they traveled to. That Jason Kenney made a statement that maybe he wasn't clear about the intentions that as trusted government officials, maybe they shouldn't be traveling abroad. And even though he had made that statement that he wasn't clear about it and took most of the responsibility of it, these people still have resigned their posts. So we'll have to keep a closer eye on that. But listen to what Jason Kenney had to say.
Good afternoon and Happy New Year. Let me begin by offering my profound condolences to the family, friends, and colleagues of Calgary Police Sergeant Andrew Harnett, who was killed last night by a driver fleeing a traffic stop. His death reminds us of the very real risks taken by police officers every day to protect public safety. This was a terrible crime, and I hope that the perpetrator is brought quickly to justice and that he or they face the most severe consequences possible under the law. As you know, the Calgary Police Service has identified apparently 2 suspects. I ask that anybody aware of their whereabouts please contact the police immediately. Let us all keep Sergeant Harnett's family and his police colleagues in our thoughts and prayers during this tragic time. And the next time you see a police officer, please thank them for their service to all of us. I'd like to address issues that have emerged regarding international travel and then provide an update on Alberta's COVID-19 vaccination program. Albertans have made enormous sacrifices over the past 10 months to protect our healthcare system from COVID-19. Thanks to those efforts, we have succeeded in bending down the curve in recent weeks as the number of active cases has fallen by about a third. Of course, we must stay vigilant. From the beginning of the pandemic, Alberta's goal has been to protect lives and livelihoods. Our approach has been to focus on public education, encouraging personal and collective responsibility, and using targeted restrictions as a last and limited resort to control spread and to prevent our hospitals from being overwhelmed. One aspect of that careful and balanced strategy has been our approach to travel. Back in March, when the federal government was refusing to take meaningful border control measures or to suspend travel from COVID hotspots, I called on them publicly and directly to do so. Alberta was the first province to put in place its own system for screening arriving international travelers, both at our airports and at the Coutts Land Port of Entry. As we moved into the summer, Alberta's government began calling actively for measures to allow for safe travel using our expanded testing capacity and other technologies. I called publicly and at several First Ministers' meetings for Canada to follow the lead of many other jurisdictions that had adopted safe travel policies, like, for example, requiring international travelers to produce evidence of a negative test. We commend the Government of Canada for finally having announced such an approach, as they did earlier this week, and it will be effective, I understand, on January 7. Alberta was the first and only province to adopt an international travel pilot program to facilitate safe travel with a reduced quarantine requirement for arriving international travelers. The program has been a success with, we think, over 20,000 people participating voluntarily as of today, and a test positivity rate of 1.48% on the first test. This compares to an overall positivity rate in the province of around 7%, and it means that we've been able to focus effectively on isolating those individuals who tested positive to keep others safe. Alberta also worked with WestJet and Air Canada and the state of Hawaii to launch a safe travel program for Canadians traveling to that state last month. They can now obtain a COVID test here at their own expense before flying to that state. And finally, Alberta has been the only province to remove an advisory against non-essential domestic travel from other parts of Canada. We have consistently been against proposed interprovincial travel restrictions, and unlike some other provinces, have continued to allow for the safe operation of important parts of our tourism industry, like hotels and ski hills. And I know that many Albertans have taken advantage of interprovincial travel, for example, likely tens or hundreds of thousands visiting neighboring provinces this past summer. All of this is to say that Alberta has sought to support and facilitate safe travel during the COVID era. We've done so as part of our effort to protect both lives and livelihoods. Completely shutting down travel would result not only in tens of thousands of more job losses, but would likely result in the financial collapse of Canada's airline industry, which is an essential part of a modern economy. For Alberta, that is particularly the case for WestJet. If all or almost all travel was to be suspended, I do not believe that WestJet could survive. And the failure of that company would frankly be a catastrophe for Alberta's economy and for our prospects of recovery and economic diversification in the future. These are some of the reasons why we have promoted safe travel. And to be clear, given all of the precautions being taken by airlines and passengers, the risks of transmission while traveling are, quotes, extremely rare, in the words of the head of the Public Health Agency of Canada, Dr. Theresa Tam. Recent studies concluded by Harvard University and the U.S. Department of Defense have both concluded that air travel has, this past year, during COVID, has been a less significant source of viral transmission than regular day-to-day activities like going to a grocery store. In this context of safe travel, between 10 and 20,000 Albertans are moving through our airports every day right now. Hundreds of thousands of Canadians have traveled abroad over the past 10 months, and tens of thousands of Albertans are currently out of the province, many of them on vacation in warmer climates. Tens of thousands more have plans to do the same over the months to come. So let me be clear. There is no public health order or legal barrier barring them from doing so. What we ask of all of those people, in fact, what we require of all of them legally, is that they scrupulously follow all of the travel-related public health orders. That includes not traveling if they have symptoms, 14 days of strict self-isolation upon arrival, unless, of course, they're participating in the pilot program, and, of course, complying with the new federal pre-testing requirement, which comes into effect a week from now. This past Tuesday afternoon, I became aware that Minister of Municipal Affairs Tracy Allard had traveled to the United States before Christmas. I immediately contacted the minister and asked her to return to Alberta, which she did immediately, arriving back yesterday morning. I should be clear that while away, Minister Allard continued to work on her important responsibilities. I was on calls and participated in virtual cabinet committee meetings in recent days in which she was an active participant. I've also become aware that a few MLAs, political staff, and senior government officials have traveled abroad in recent weeks. In doing so, I'm assured that they have complied with all relevant public health orders and legal requirements. Nevertheless, I recognize that those of us in positions of public trust must maintain a higher standard in our personal conduct than is expected of the folks in the general population, in the general community. And here I take responsibility for not having clearly set out or communicated a policy against international travel for senior decision makers in government. I should have done so. To be blunt, I'm not in the habit of tracking or regulating what the people who work for me do on their personal time. I believe that these individuals acted in what they believe to be good faith, have complied with the legal requirements, including the COVID public health orders. But for those of us in leadership, I acknowledge that is not good enough. We should be here at home, plain and simple, if we carry a position of public trust. And that is why I am issuing a clear directive today to cabinet ministers, government MLAs, political staff, and senior executives in the Alberta Public Service not to leave the country for the foreseeable future unless it is absolutely required for government-related business. And I see that as being a very remote possibility. In 10 months, I have not found a requirement to travel abroad for government-related business. I understand that individuals who were abroad have either returned or are in the process of doing so. Again, I take responsibility for not having been absolutely clear about this expectation. And I do not believe that I can sanction people who complied with the law, with the public health orders, and who in fact participated in the kind of safe travel that our government has facilitated. Finally, I'm pleased to announce, on a separate matter just before taking questions, I'm pleased to announce that we are making a significant progress in accelerating the pace of the COVID-19 vaccine program. As you know, when I participated in an update on Tuesday, I expressed our disappointment with the pace of vaccination in the first 2 weeks of the program. But I'm pleased to say that AHS has responded by significantly increasing the pace of vaccinations. They, contrary to their original plan, scheduled vaccinations today. And
I want to thank you for listening today. We are trying to keep up with all the news that's happening over COVID-19 and also with human rights to do with COVID-19 as best as we can. There are new things happening all the time, and we will do our best, if you follow us on Twitter, to keep up with breaking news. So thank you again for listening, and you've been listening to Policy and Rights here on Depictions Media, and I am Michael. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.